All right. Well, welcome everybody. Everybody that's tuned in to learn a little bit about Medicare. We're so excited that you're here and that it's getting closer for that time for you to understand the basics of Medicare. My name is Mark Bilgier with Bilgier Insurance. And tonight we're going to go through the basics. It'll seem like there's a lot to learn. There is a lot to it, but at the same time, hopefully I can walk you through it so that you don't spend a lot of time on the things that aren't really necessary. A lot of people try to dig into the details, and quite honestly, some of the details don't matter only because they change every year. And so knowing the specific number for this year versus next year is a nice to know. But if you're not actually enrolling till next year, then this year's number doesn't matter anyway. So that's what I mean. But I'll point those kinds of things out. So let's get in right away. All right. So again, my name is Mark Bilgier with Bilgier Insurance. We're going to talk about some Medicare. Sorry about that. All right. First question everybody asks, when am I eligible? Well, you're eligible the month of your 65th birthday. That's when you're first eligible for Medicare, the month that you turn 65. You always get to start on the first of that month. So even if you're born on the 31st, you get those extra 30 days. If you're actually born on the first, you get to start on the first of the previous month. So that's a one-off for just the people that are born on the first of the month. Once that is coming up, you actually have a 7-month enrollment period. So eligibility and enrollment are not the same thing. Eligibility means you could have it if you wanted it. Enrollment means when can I join it? Well, based off your 65th birthday month, you get the 3 months prior to that month and the 3 months after that month. So you get 7 months total. This is your initial enrollment period. Some people will say IEP. It's one of those things you're going to get bogged down in. You'll get really confused. So I try not to do that with my clients. I try to keep it as simple as possible. This example, if you're born in April, you have January 1st through July 1st to enroll. Now, why is that important? Because if you miss that enrollment period, now you're getting into not having creditable coverage, which we're going to discuss, and you could possibly have penalties moving forward. And if you get Medicare penalties, they last forever. They never go away, and they go up every year. So we really want to avoid them. Doesn't mean you have to do it this time. Don't have to enroll during your initial enrollment period, but this is the first time you get. Like I said, if you're born on the first, you actually get to start the month before. And if you're already collecting Social Security disability and you're under 65, there's a special enrollment for those people once they've been on disability for 24 months. Then they're automatically put on Medicare. We're not going to focus on that tonight, though. But if you ever talk to somebody and they say, well, I had it before I was 65, that's probably the reason why, because nobody gets it before they're 65 unless they have full disability through the government. So the 7-month window, 3 months before your birth month, 3 months after is your original or your initial enrollment period and your eligibility. So if you're already collecting your Social Security retirement benefits, guess what? Social Security, they'll sign you up for Medicare. So that's pretty convenient, unless you don't want to be on Medicare, because then you have to go in and decline it. And we're going to talk about that in a second. Most of the time, people who are already receiving Social Security have retired or at least gone to part-time work, so they don't have employer benefits anymore. So it actually is a very convenient thing for you. If you're not collecting your Social Security, but you do want to start your Medicare, then you have to sign up for Medicare on your own. They won't automatically start you on your 65th birthday. It doesn't work that way. So how do you do it? You go to ssa.gov, and then there's a link that says sign up for Medicare, and you just follow along, type in all your demographic information, your birthday, where you were born, your address, all that kind of stuff. It's not hard to do. You just need to know when to do it. That's the hard part, deciding when you want to do it. Then this is what I was referring to. Am I required to enroll in Medicare when I turn 65? Absolutely not. Whatever anybody tells you, you're not required to enroll into Medicare just because you're 65. you are required to have what we call creditable coverage once you're 65 in order to avoid those lifetime penalties if you enroll later. So what does that mean? That means if you're still working and you have benefits through your employer, you can keep those benefits if you want. What we do with our clients is we compare Medicare to their employer benefits, and whichever one is going to give them the most bang for their buck or the better health care, whatever they're looking for, then that's the way we go. Now, there's several things that go into that, but that's what we do. But you're not required to sign up when you're 65. However, here's those penalties. If you don't have creditable coverage, so you don't have Medicare or employer benefits, so you don't have any coverage, then when you try to get into Medicare later at 68 or 70 or 72, you're going to pay a penalty. You're going to pay a penalty for every year you didn't have Part B, which is your medical insurance, and you're going to pay a penalty for every month you didn't have Part D, which is your drug coverage. They give you a little bit of time, sort of a grace period on that, 63 days. But once those penalties start adding up, again, they get bigger the longer you don't have it, and they'll go up each year with the cost of Medicare, and they'll never take them off. They stay on forever. So when to enroll is really important. Talking with a broker who will show you all the ins and outs of that is really important. Make you feel like that. All right, so what if I want to continue working? That's probably the most common question I get. Well, like I said, you can continue your employer benefits if your employer has more than 20 employees. Why is that? Because employers with 20 or more employees, their insurance is considered creditable, meaning it's as good as or better than Medicare. If they have 19 or less, they don't consider it creditable, and they're not going to let you keep it. Well, you can keep it, but they're not going to think that you have good enough insurance, and you'll get those penalties later on down the road. Some people will go ahead and keep their employer benefits, but enroll into their Part A anyway. And the reason that is Part A does not have a premium if you have your 40 qualifying quarters, which means you've worked about 10 years and been paying into Social Security for about 10 years, or 10 years, I should say. And there's no premium for that. And it'll be a little bit of secondary hospital insurance. It's only inpatient in a facility. It doesn't work with doctor's appointments. It doesn't work with MRIs. It doesn't work with the emergency room, anything like that. Only if you're an inpatient in the hospital. I talk to people individually about it because it doesn't, a lot of people say, well, just do it. It doesn't cost anything. Well, it can cost you something. It can really cost you a lot if you're contributing to a health savings account. If you have a high deductible plan through your employer, and either the employer is contributing to your HSA or you're contributing to your HSA, by enrolling in Part A, that's considered a low deductible plan. And once you have a low deductible, you can no longer contribute to an HSA. Well, if you don't know that and you over contribute, guess what? Then you're going to get penalized for over contributing. You're going to have to pull all that money out, and it's a real mess. So talk to somebody who can explain, your different options and how to approach it and what your timeframes are, because that can be an issue for some people. Then for your Part B and your Part D, which you have to have, you can enroll once you leave the employer. So you can work till you're 67, 70, 75. It doesn't matter as long as they have more than those 20 employees. But once you leave the employer, you have 8 months. That's your new enrollment period. It's not your initial one. Remember when you were 65, that was your initial. This is a different one. This is an ICEP. So you have 8 months after you leave that employer to get your Part B, which is your medical. And your Part D, you only have 63 days. And Part D is the prescription drug plan. They want you to have creditable drug coverage and creditable medical coverage. And we're going to talk about each one of those here in just a second. The A, B, C, and D of Medicare. This is where a lot of people get really confused, and we're going to go through each one. I'm going to make this a little bit bigger for us. All right. So what is Medicare Part A? Remember I said it was facility and hospital. So what I like is inpatient. I like saying it's inpatient better. That's what Part A covers. It comes from Uncle Sam. Only two parts come from Uncle Sam, A and B. Part A is the first one. There's no premium to have it. You've been paying for that through your FICA. And so all those years you've been working, they've been taking a little bit of money out of your check. Part of that goes to pay your Part A. So I go in the hospital. The first day I go in, I have a Part A deductible. For this year, it's $1,736. That changes every year. So that's why I say maybe don't get bogged down. If you're not actually enrolling this year, it'll be a different number next year. And that lasts for the first 60 days. So consider this sort of your room and board, right? It's kind of like in a hotel. You get your bed, you get your bathroom, and that's the nice part about it. But if you want room service and you want people to do things, go to the spa, do your laundry, stuff like that costs extra. So your Part A is going to cover sort of your room and board. It's going to cover your food, and it's going to cover your regular nursing. But when the doctors come in, or if you have surgery and things like that, that's a different thing. So that deductible lasts for the first 60 days, though. So that's not too bad. Day one's pretty expensive, and then it gets cheaper and cheaper each day because you get it divided out. But if you're there for a long time, 61 days or more, you go to a daily copay of $439. That's out of pocket. That's what they don't pay anymore. If you're in for a really long time, over 90 days, then it goes up to $868 per day. That can happen. It doesn't happen a lot. Usually by then, you've moved to a different facility. So now you're in inpatient and skilled nursing. It's either that or skilled nursing is what we also call rehabilitation. This happens a lot when people have major surgeries or they had some sort of an injury. They can't walk, they can't get around, they don't have anyone at home that can help them yet. So they can't stay in the acute care hospital, the big hospital, but they're not ready to go home yet. They can go to a rehab hospital. Part A actually does a good job. They pay for the first 20 days of that. $0 copay. That's pretty awesome. Days 21 to 100, however, jump up to a $217 copay. And after 100 days, it's straight out of pocket. So there's no max on that if you're in there for a long, long time. Home health care. This is another one people get really bogged down in. And I'll tell you the simple way is sometimes it's Part A, sometimes it's Part B. Who pays for it? Doesn't really matter if you're not paying for it, if it's either A or B. If you come out of the hospital and the doctor prescribes it, that's probably going to fall under your A. If you just go see your primary care and he or she prescribes it, that's probably going to fall under Part B. That's the difference. But again, don't get bogged down in that. Just know that it's kind of limited. A few days per week. If it's under Part A, it's going to be $0. And they're going to want to see, improvement. It's not just going to be physical therapy for an extended period forever, but it's going to keep checking back to see that there's progress being made. Another facility you could be in is hospice. They're still around. Most people don't do it. You could pay up to 5% of that cost. It's not always charged. And if you do it at home, there's absolutely no charge. For hospice, if you go into a psychiatric hospital, it's basically the same as the acute care hospital. So it's not that much different. But remember, you're an inpatient in all these places. That's Part A, $0 premium. So what is Part B? Remember, there's only two that come from Uncle Sam. Part B is your outpatient. It's your physician, medical, or outpatient. This year, it's $202.90 per month for your Part B. That's for 2026. And it has an annual deductible of $283. Once that deductible is met, this is for all your outpatient or anything that a doctor does to you. Once that deductible is met, Medicare becomes an 80-20, where it pays 80% and leaves you 20% as coinsurance. There's no limit on that 20%. That could be a real problem. That's one of the gaps. So all those Part A deductibles and copays are gaps. This deductible is a gap. This 20% is a gap. And that's what we try to fill for people. So what does Part B include? Going to the doctor as an outpatient procedures, MRIs, CT scans, outpatient surgery, day surgery, in and out the same day, emergency room, ambulance. Some outpatient drugs are classified as Part B. I'll talk about those a little bit in a minute. So the things that are just sort of normal part of our healthcare, not in an inpatient any place, that's going to fall under Part B. Part B does have a premium. It goes up every year. It does have a deductible, and it goes up every year. So next year, 2027, both those numbers will be different. That number, however, can change this year. The 202.90. What Medicare does is they look at your income, and if you're a high earner, you get what's called an income-related monthly adjustment amount. IRMA. Just call it IRMA. We don't like IRMA. I apologize to anyone named IRMA, but in this case, we don't like IRMA because it's going to change our premium. So here's the example of the 2026 thresholds. When I start Medicare, Medicare is going to look back 2 years to my 2024 income. And if I was married filing joint and our AGI was $218,000 or less, then I'm going to pay the 202.90. If it was $1 over 218 up to 274,000, I'm going to pay $284 for my Part B. And if my spouse is also on Medicare, she's going to pay $284 for her Part B because we're filing joint. So it's both of us. And then you can see as the thresholds go up, the IRMA adjustment goes up. Same Part B, same as this person. If you're a very high earner and you're both on it, it's almost $700 each per month. That's pretty high. In addition to your Part B IRMA, you get a Part D IRMA, where they add a certain amount to your Part D plan. There's no addition if you're on that base level, but if you go up in income, you could pay even more. So knowing the IRMAs for when you retire and knowing what you've made 2 years ago, 2 years prior to when you enroll, that's what's important. Again, that's something we help our people understand. So a little bit more. Remember, you have to have creditable coverage. This is what that coverage is being measured against. It's being measured against Part B. COBRA is not considered creditable coverage. A lot of people think, well, I'll just get COBRA. I know it's kind of expensive, and I'll use it for a year, then I'll get Part B. Guess what? That's a year you didn't have Part B. You didn't have creditable coverage. You're going to get penalized. Even though you paid that higher price for COBRA, it doesn't count. It's not creditable. You got the 8 months of COBRA is all you can do. Still have to enroll in Part D within 63 days to avoid penalties. If you have Veterans Affairs health coverage, that does not count as creditable medical coverage. So using the VA does not count. You still have to join Medicare. A difference is if you have TRICARE for life, and if you know what TRICARE for life is, then you know what it is. It's for our retired military. And theirs does count, but regular VA does not count. All right, so what is Part D? Part D is easy to remember. D for drugs. It's a prescription drug plan. The government likes us to have some type of coverage for Part D. However, they do not provide it. It comes from a private company, a private insurance company. It covers your prescriptions. Now, remember I said there's a few things that are Part B drugs and Part D drugs. Part D, as in David, are what we call self-administered drugs. They're the drugs I put in my hand, I pop in my mouth, and take a swig of water. The things a lot of us take every day: statins, high blood pressure, metformin, levothyroxine, lisinopril, amlodipine, all those kinds of things. If you can give it to yourself, it's going to be a Part D drug. If you need to go to a doctor's office or some sort of clinic, and they're going to put it under your skin, or they're going to administer it through an IV or through an injection, that's Part B because you're going to that doctor. So Part D, self-administered. Part B, you go to a place to do it. The easiest example to understand is chemotherapy. If you go to the chemotherapy center and you sit there for 3 hours, that's Part B. Part B is going to cover that, 80-20. If you can pop it in your mouth, they're going to call it a Part D. If you are covered through prescriptions through TRICARE or VA benefits, you do not need to enroll in Part D. Don't ask me why. Nobody can figure it out. They will count the VA as creditable drug coverage, probably because they're getting the same drugs, but they don't count it for medical coverage, but they do count it for drug coverage. So some veterans can go without a drug plan. They'll just get Medicare, and then they won't get the Part D, and that's okay. They can do that. The average premium this year is about $34.50. Honestly, it goes from $0 to about $160, somewhere in there. So this average is really a bad number. What it's based off of is your individual drugs. So you will have to look up your drugs, and then the system can tell you exactly which plan would be most cost effective for your drugs, what they would cost at each pharmacy in your zip code each month. It'll break all that down for you and tell you. It's really, really kind of neat. Just as an aside, Medicare, CMS, Center for Medicare and Medicaid Services, and the carriers that sell these drug plans no longer let brokers like me help people with their Part D. They've told us they want people to learn to do it on their own, so they don't let us. And so you're going to find a lot of agents or a lot of brokers aren't doing it. A few still do, but they're really not supposed to be doing it. So let's talk a little bit about the drugs and what they're going to cost. I can't give you numbers, but I can tell you a little bit what's going to be expensive, what's going to be cheap. Drugs are divided into different tiers, 1 through 5. Tier 1 are your preferred generics. Those are the least expensive drugs in the market. Those are the ones I rattled off a couple minutes ago. A lot of us take a few every day. They're typically $0, between $0 and $5. A lot of plans are $0. Generic drugs, so the only difference, preferred and not preferred, they're going to be a little bit more, maybe $10 in that area, give or take. Some might still be $0. Just depends on the plan, just depends on the drug. But then when you get into preferred name brand drugs, this is where they start to get expensive. And every time you go above tier 3, they're going to get more expensive. Tier 4 is more expensive than tier 3 typically. And then the most expensive are tier 5 specialty drugs. Tier 3 drugs, or I should say tier 3, 4s, and 5s, you'll know that you have one of those. You'll know if you're on a tier 5 because it's astronomical what it costs. Tier 3 are pretty expensive, but the other little hint, if you see anything advertised on TV, it's at least a tier 3, if not higher. They do not advertise tier 1s and tier 2s because they don't need to. Enough of us already take them, and they don't charge any money for them. The ones they advertise, they got to charge a lot more money for. So tier 1 is the least expensive. Tier 5 is the most expensive. Different carriers can classify the same drug in a different tier. It doesn't usually happen. Usually if it does, it might be between a 3 and a 4 or a 1 and a 2. Nobody's going to classify a 1 as a 5 or a 5 as a 2. It may just be 1 right above or below. It's not super common, but they can do it. So how do these carriers control their prescription costs? Well, they have a couple of different ideas. They have one that's called step therapy, where they require the plan. Oops. Oh, no, that's right. Sorry, I got confused. If there's more than one drug that's going to cover a condition, they're going to have you try the cheaper drug first. And if it doesn't work, then the doctor can tell them it didn't work, and they'll say, okay, they can try the next level. That's step therapy. You start low and you step up. Quantity limits, they're just going to limit the number they give you. A lot of us get some of those inexpensive drugs, 90-day supplies. That's no big deal. There's some drugs they just won't do that. They're not supposed to be taken every day, so they won't give you 90 days worth. Certain opioids and things like that, they'll only write. I know a lot of people will go and have some kind of surgery and they'll write them, 10 pills or 14 pills or something like that with no refills. So they can limit the quantity. Or they're going to have a pre-authorization. So the doctor may give you a prescription for one of those new meds that's a 3 or a 4, tier 3 or 4. You take it to the pharmacy. Well, the insurance company is going to call the doctor and make sure they really think you need that one and not a cheaper drug or not a different one. And they're going to try to, I don't want to say they're going to try to deny it. They're going to get some extra information to make sure it's the right thing. And then finally, you can get what's called a formulary exception. A formulary is the list of drugs that your plan covers. And they all cover thousands of drugs, but they don't all cover the same. So a good example is there may be an expensive drug for psoriatic arthritis. There's 3 or 4 out on the market. Well, your plan may just cover drug A, but doctor says you need drug B. The company doesn't cover drug B. They're going to say you need plan A. Well, if you haven't tried drug A, they're going to force you to try it first. And then if the doctor knows that it won't work for you, because some of these have different ingredients and doctors sometimes know, no, you can't take this one. Then the doctor can fill out a form, request an exception, and the company can grant it. It's up to the company. It's up to the provider, or not the provider, the carrier, whether they want to do it. They can do it, but they don't have to charge the same price they were going to charge for the first one. If they have that labeled at a different price, they're going to charge that price. So a lot of the control and a lot of the power, I should say, is in the hands of the carriers, the insurance companies. There's your step therapy, your limits on quantities, your prior authorization. They're going to say yes or no, or maybe you can get a formulary exception. Now, since 2025, the drugs have changed. So 2026, and it's kind of a good change. It depends on what side of the fence you're on. So you have 3 phases to your drug plan. Phase 1 is you pay 100% of your prescriptions till you reach the deductible. The deductible for this year is $615. However, that $615 is the most they can charge for a deductible. And a lot of the plans don't even charge the deductible on tier 1 drugs or tier 2 drugs. And there's a few that don't even charge it on tier 3. Not as many, but most of them don't even charge it on tier 1 or tier 2. So if all you take is, a simple blood pressure in the morning, they're not even going to make you pay that deductible. You're going to get it for free all year long. If you are paying the deductible, then once you hit the deductible, you're just going to pay whatever the listed copay is in your plan. And it'll tell you tier 3s are this much, tier 4s are this much, tier 5s are this much. The reason I can't give you a number is because a lot of them are a percentage of the retail price. So it depends on what the retail price is, and then it'll be a percentage of that. However, as you're paying that along, they're keeping track, and they're keeping track of how much money they put in, and these plans will add up that money. And once that reaches $2,100, now you've hit the catastrophic phase, which is phase 3, and you don't pay any more copays for the rest of the calendar year. So if you hit it in June, you get about 6 months of no copays. Now you still pay the premium for your plan. You have to maintain your premium, but you don't have any more copays for your drug. So that's kind of good. That keeps it from getting catastrophic. That's not tied to your Medicare max out of pocket or anything like that. Drug plan, remember, this is its own thing. Drugs are counted separate from your health benefits. And there again, brokers are no longer allowed to help people with their standalone drug plans. It's really unfortunate. We're not sure why they want to do it that way, but that's the way it is. So remember I mentioned the gaps. We wanted to fill the gaps. There's 2 ways to cover what Medicare doesn't cover. And one is called a Medicare supplement or a Medigap. And these are the same exact thing. And you hear a lot of people say one or the other. These 2 things are the same type of product, okay? And you got to think of it, supplement, you got to think of that as a noun, all right? So it's a Medicare supplement or a Medigap. These are offered by private insurance companies. They have an additional premium. So in addition to your Part B, your $202.90, you would have another premium. And then all doctors will accept this. It will pay all of your Part A charges. So all those deductibles for being in the hospital, or the deductible and all those copays at $438 and the $800, it pays all those. So all those go away. And then once you reach your Part B deductible, which this year is $283. Remember, Medicare becomes an 80%, 20%. This plan comes in and pays the 20%. So you don't really have any other medical bills once you've hit that 283. So that's pretty nice. You still have to pay the Part B annual deductible, which again this year is 283. That's hardly anything for deductible. If you're on commercial insurance right now, if you're under $3,000, that's pretty great. This is 283 this year. There's two main plans that are being sold right now. There's about half a dozen in the market, but the two that are being sold the most are Plan G and Plan N. But then remember, Medicare is not going to pay for your drugs. So you have to come in and get a second plan, which is your Part D or your PDP. That's also offered by a private insurance company. Helps cover the cost of your Part D medications, and they passed those new rules in 2025. Now they're carried over to 2026, that $2,100 max out of pocket, which is really good for some people. If you weren't ever close to there, then it doesn't really make that big of a deal. If you take a bunch of tier ones and they're all free, it doesn't really matter. So Medicare supplement or Medigap, you're going to pay extra each month to have that plan. The other option is what you're going to see on TV all the time, Medicare Advantage plan. Here's the very important thing to remember. This is also called Part C. In my opinion, the insurance company got to bamboozle the government a little bit and let us name this Part C, or let them name this Part C, so it sounds like it's from the government, like Part A and Part B. It is not. It's a Medicare Advantage plan, comes from a private company, not offered by the federal government. Part C is not required. A and B and D are, but Part C is not. It will have copays and coinsurance. It's going to have some sort of network-based setup. It's going to be an HMO or a PPO. Most of them include a drug plan. Now, a few that don't, they're actually kind of built for veterans. Remember, I mentioned some veterans use the VA for their drugs. They can get these plans, not have to have the Part D, and they change the benefits a little bit. So that's usually the only people that use those that don't have drugs. Most people keep them. And then it has a annual max out of pocket. That means that if all your copays and coinsurance ever add up to a certain amount, then you don't pay any more for the rest of the calendar year. And where I'm based in Dallas-Fort Worth, it's about $4,000 a year. So again, that is what keeps it from becoming a catastrophic event if you have some sort of healthcare issue. $4,000 is still a lot of money, but it's not $40,000 and it's not $400,000. So that's important to remember. We need to keep an eye on what the health insurance is meant to be for. And then a few of them offer extras. You see that a lot on TV, dental, eyewear, hearing aids, fitness. It's very important for me to write eyewear, and I'll tell you why. On TV, you're going to see them say dental vision hearing, and people think their eyes aren't covered. Well, that's not true. Your eyes are covered by Part B. That's medical. Medicare does a great job on that. Cataracts, glaucoma, macular degeneration, anything like that, that's Part B. The vision that these HMOs talk about, or these PPOs, are glasses, which is still a nice benefit if you have it, but it's not your eyes. So don't think you need to get this to have your eyes covered because this one doesn't do it. That's not true at all. The supplements cover disease in your eyes or in your ears very well. This is just glasses, hearing aids. Some have a gym membership. Some have an over-the-counter benefit where you get $40 a quarter, $50 a quarter for Band-Aids, cotton balls, vitamins, things like that. So Medicare Advantage and Part C are the same exact thing. Medicare Supplement, Medigap are the same thing. Medicare Supplement, Medigap, you'll pay an extra premium and then hardly anything because all you pay is your $283 deductible and then all your medical bills are paid. Medicare Advantage, you typically don't pay for to have it, but then you have a copay or coinsurance every time you go use a service, whether it's a specialist or an MRI or an ambulance, the emergency room, go to the hospital, have an outpatient surgery. All those will have a copay, and they all vary based on the specific plans. All right, so some of the details. So your Part C, remember that's the Advantage plan, that combines your A, B, and D into one plan. So it eliminates some of the out-of-pocket costs, meaning you don't have to pay the premium for those plans, that being the D. Those premiums go away. It'll have set copays for listed services. They all have copays for the same thing. It's just some are $15 for a specialist, some are $20 for a specialist. And they just take a certain amount of money and they juggle it around to find the things that best suit you. So they're trying, the reason there's so many plans is because there's so many people, and they're trying to find plans that can accommodate lots of different people. They all have that maximum out of pocket, or that MOOP, we call it MOOP, to prevent catastrophic events. They're all evaluated on a star system. So 5 stars being the highest, being the best, 1 being the lowest. If anybody's ever below a 3, they get a lot of flack from the government. The government doesn't really like it. You should only be working with 4 and 5 star plans. They'll throw in some of that stuff that's not covered by original Medicare, dental, vision, but then I threw in glasses and contacts. That's really what that means. Hearing aids. You'll see this advertised October 15th through December 7th a lot. That's the annual enrollment period. So if you're just turning 65, this doesn't have anything to do with you. Remember, when you're 65, you have your initial enrollment period. So your enrollment time is all different. Once you're in it for a year, then every fall they come out with new plans. You get to evaluate the new plans. And if you want to change on January 1st the next year, you do that between October 15th and December 7th. That's when the commercials, the TV commercials and the phone calls really ramp up. That's what that's all about. All right, so we're getting close to finishing up. I'm going to show you a few of the don'ts and do's. I'm going to start with the don'ts. If there's any questions in the chat, put them in there, and we'll take a look at them. First one, don't take retirement account distributions 2 years before signing up for Part B without being aware of the financial consequences. This goes back to that IRMA, that income-related monthly adjustment amount, because you may be working your job now and you forgot, we had a rental house, or we had an inherited IRA and we had to take a big, we had put it off for 8-9 years. We had to take a big chunk out of it. Well, that counts as your income. And even though it was 2 years ago, remember they look back 2 years. And if your income was higher than that first threshold, you're going to get an IRMA. You're going to get an adjustment, and you're going to pay more for your Medicare B. So it's not, I'm not saying don't do it. I'm saying just make sure you know what the consequences are when you think you're going to enroll and know what's going to happen. A lot of people just do it and they just know for a year they got to pay a higher rate, and then it goes back down when they get back to their regular income. Don't delay enrolling in your Part D or B if you don't have other creditable coverage. You get those penalties, and they don't sound like very much at first, but they last forever and they go up. So it's really terrible. Don't automatically assume that a well-known company is the best company when you get into Medicare. There's a lot of really strong companies working with employers and working with unions and things like that. They may not be the best in the Medicare space. It just depends on the company. It depends on your geographic area. They may be, but they may not be. So just don't assume that they are. Work with a local broker, and they can guide you. Don't sign up from an unsolicited phone call. If you hate getting them, stop answering them. Stop signing up. They'll stop making them. Don't sign up from a TV 800 number. And the reason that is, those are coming from the carrier. So if you call the carrier, all they can tell you about is their plans, right? They can't tell you about other carriers. If you work with a broker who carries several plans in your area, they can tell you about all the plans. And the good part about that is if you use a local broker, there's no cost to you. It doesn't cost you anything to use a broker. The carriers pay a commission, and the best part about that is CMS regulates the commissions, and they're all the same. So whatever carrier I use, I get a commission if you enroll, and it's the same off each one. So my goal is not to put you in a certain plan, is find the plan that's best for you. So August of next year or October of next year, you come back and you stay with me, and we keep doing it over and over. You do not save any money by calling the carrier or by enrolling on TV. You do not. It's just frustrating. You don't get straight answers all the time, and people have a specific agenda, a very narrow agenda, and it's their carrier. So you're not going to save any money by not using a broker. You're just going to save a lot of time and frustration. So do make sure that the plan you're enrolling in is suitable for you. For instance, if you don't get VA benefits and you don't get the plan with drugs in it, guess what? You're going to get penalized. So make sure. Make sure that you understand the plan. And if not, ask for clarification. They can be confusing. I get lots of calls from people that think they understood it, or they talk to their neighbor. And so they got a plan because their neighbor got it. And they called me and they said, well, my neighbor gets this. And I have to explain to them, well, that's not exactly what it is. And it's usually because there's a couple of reasons. One, they're getting older and they just don't remember. Or two, they just don't pay attention as we go through it because it seems so overwhelming that they kind of shut down. And then they rely on us to walk them through it again later in the year, which is another thing that's nice if you're working with a broker, because we can do that. We can provide a service level that the carriers just don't do. You don't have to sit on hold when you call us. Do you know what Medicare covers and what it doesn't, right? Doesn't cover drugs, doesn't cover long-term care, doesn't cover glasses, doesn't cover custodial care. If you need someone to come into your home to help you with dishes, making meals, walking dogs, taking care of pets, things like that, none of that is covered through Medicare. So make sure you know what it covers and what it doesn't cover. So we're just about to wrap up. If there's anybody that have any questions or any comments in the chat, please go ahead and leave those. And again, my name is Mark Bilger with Bilger Insurance. There's our office phone number. You can also just send us an email at info@bilgerinsurance.com. We'd be happy to help you. We do life, health, Medicare, cancer, heart attack, stroke, just about everything except for cars and homes and boats. I don't do any of that kind of stuff. Just people stuff is what I tell them. So we are very glad that you joined us tonight. If there's no other questions, we will go ahead and sign off. Tomorrow morning, we're going to be doing long-term care at 10 in the morning. If you have any questions about that, tune in for that, and we'll take care of you then. So thank you again.